Good afternoon. Welcome to the daily briefing here at the St. Clair County EMA office, where I'm joined with Chairman Mark Kern, and Sam is back from the health department.
Yes.
Good. We're always glad to have you
Oh,
back.
thank you. Happy to be back.
Barb has been filling in for you,
She has.
and
Yes.
but you're back, and you get to be the numbers lady today.
The numbers lady today. So as of today, 33,451 St. Clair County residents have been tested, and that is an increase of 681 from yesterday. We are at 3,659 positive test results, which is an increase of 66 from yesterday, and that does include both males and females from under the age of 10 up to their 70s. And for St. Clair County, our positivity rate for today is 9.7%. We are at 29,780 negative test results, and happy to announce that we have no new additional deaths to report today, so we are standing at 151 deaths for the county. And those that have completed the IDPH required 14-day quarantine, we are at 2,581. For state totals, 2,608,651 have been tested, with 175,124 positive test results, which is an increase of 1,393 from yesterday. And for the state, we are reporting 7,462 deaths, which is an increase of 18 from yesterday. And as always, our thoughts and prayers go out to those who have lost loved ones. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 40 patients that are admitted due to COVID-related reasons, and one of those patients is currently on a ventilator. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, we are just going to do the facilities that have changes. The first one, Bria of Belleville, which has 62 cases and 7 deaths, which is an increase of 1 case at that facility. And Caritas Family Solutions in Belleville, they have 20 cases and no deaths, which is an increase of 1 case for that facility. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So, Sam, I noticed today we talk about the cases of in people under 40 years of age. Today, we almost reached the 2/3 of the cases are under 40. That age group is really showing in these statistics.
It is. We are certainly seeing that trend from, as we've talked about on other days, the older group that we had started out with that we thought was our most severe case. We've seen that age decline, and we are now in that mid 25 to 45 range.
And when we do our tracing and ask the questions, we're finding that gatherings, large gatherings, and the bars, those places are pretty common ground where people are catching this virus.
And we're hearing a lot of the I didn't think it could happen to me mind frame, and that's what we try to stress. It does not discriminate age, gender. It doesn't pick who it goes after. So it really honestly can happen to anyone. So that's why we stress the same precautionary guidelines for everyone out there.
But somehow it doesn't pick as many people with masks.
It does not.
That's why wear that mask, wash those hands, and watch your distance.
Absolutely.
Those are the 3 W's, the rules we live by in
Yes.
this day and age. So we'll move into the zip code report for today. In 62059, we remain at 9. 62201, we remain at 174. In 62203, we went up by 2 today to 148. In 62204, we go down by 1 today to 108. Remember, we also go up if we have COVID positives. Sometimes there's a change in the zip code or some sort of change is made. So we do, to keep our numbers accurate, we take them down 2. So today we go down 1 in 62204 to 108. 62205, we went up 2 COVID positives today to 141. 62206, we went up by 6 to 329. In 62207, we remained the same at 196. 62208, we go up by 5 to 229. 62220, we go up by 3 to 287. 62221 went up by 7 to 315. 62223 goes up by 6 to 153. 62225 remains the same at 16. 62226 went up by 13 to 376. 62232 goes up by 2 to 77. 62239 goes up by 2 to 37. 62240 went up by 1 today to 14. 62243 goes up by 1 to 24. 62254 remains the same at 114. 62255 goes up by 1 to 12. 62257 remains the same at 19. 62258 goes up by 4 to 53. 62260 remains the same at 39. 62264 remains the same at 65. 62269 goes up by 6 to 238. And 62285 goes up by 1 today to 31. As keeping with our pattern and practice, we're talking about schools and have been for the past week. And today, once again, we're going to talk schools, and today we're going to talk with Dr. Craig Fiegel, and Craig's the superintendent of Muscuda High School. Welcome, Doctor.
Thank you very much for having me.
We appreciate you being here. So, school boards met?
School board has met. We laid out our plan. We spent the month of June and July developing our plan, looking at options, knowing that we would have to present, or at least feeling like that was the directive, to do something in person along with a remote option for parents. So that's where we're at currently. We're providing a remote option if that's what they choose, and then also an in-person. We continue to look at that plan and decide, is that viable as conditions continue to change rapidly. And so we are trying to figure out how do we do, we actually had a hybrid model. The problem with the hybrid model in our district is we're K through 12. And so that's a real child care issue for some of our parents, and we're trying to be cognizant of that, weighing that against the idea of safety, of course, which has to be forefront.
So, what's going to happen? School starts what day?
Well, our school's supposed to start on the 13th of August.
That's not too
And
far away.
That's not too far away.
So what does that first day look like?
First day for us is going to look like all of our remote learners are going to be scheduled to come in that Thursday and Friday and receive Chromebooks, receive directions on what they should expect, meet their online teachers so that they can be able to navigate that process. Then we're going to bring in students based on grade level one at a time so that they can go through the building, know what the new procedures are. So like, for example, the high school, let's say ninth graders come in on Tuesday and they'll talk about having to wear masks, talk about new procedures in the hallway. You know, maybe at the middle school it's eighth graders, and for example at the elementary it might be kindergartners and fifth graders. And then they'll go through the procedures, talk about social distancing, what they need to do. Our secondary schools, middle school, high school, will dismiss early, so they will not have to serve lunch. But because of the way we bus and doing alternate busing times, we're going to have the elementary there, and we felt like we needed to try to feed them. So we've set up alternate feeding sites, not just the cafeteria, but the two gyms, so that we can social distance those, feed our students at the elementary level.
So what percentage of students, and I guess we'll separate the grades, or is the percentage the same that will actually attend, and what percentage will be remote?
Right now, it looks to be pretty consistent across the board that we are looking at about 30%. What we are trying to encourage parents to do is get in those online registration forms so that we can determine who do we have to expect to be there and who do we expect to be remote.
So 30% remote?
That's the way it's looking right now. Yes.
And are you doing this on a quarterly basis? You sign up, you're remote for a quarter, and you can switch then at the quarter?
That's what we've asked them to do, is commit to a quarter at a time. It's just more efficient for grading, for teachers, for those kind of things to get that set up.
How about your faculty? Are they they've got to be really burning the midnight oil right now, putting the curriculum together?
Yes, staff right now is pretty anxious. We're having, we are trying to look at those staff that don't feel comfortable coming in for health reasons, for maybe whether it's their personal health or someone within their household, etc. So we're looking at requests to be remote teachers versus coming in person. That starts to be the real challenge, is do we have enough staff to address the in-person? I think that staff continues to be very concerned about their health and what it means to be around children. Parents are probably, they have an option right now. If they don't feel comfortable, they can be remote learners. If they feel comfortable coming in, more difficult for staff, because we have to have staff there to handle the in-person if that's where we continue to go. We are continuing to review that, considering whether, based on the number of staff that need to be out for health reasons, if we can actually man the in-person learning, or whether we'll have to look at some other options like hybrid of some sort, where we do most of the instruction online and then invites different groups back in, so we keep groups small.
If you are a remote learner, will you be watching the classroom, getting classroom experience, or will this be a lesson plan put together?
Well, we're hoping that what we can do in a lot of cases is film a lesson as it occurs, like your first hour English class, for example, might be filmed, and then we would push that out. It can't be live. We don't have that kind of capability, but we do have the capability to film it, put it out there. We do have Zoom capability, so we are asking teachers to be online and in person with their classes at some point during the day. So we're trying to kind of figure all that out and trying to figure where the right place is, manning, safety, and we all agree that having students in person is the most ideal way to teach students, and that's what we want to try to achieve. But we also understand that with what's going on health-wise and all those concerns, we have to balance that.
So, are you taking temperatures at school, or are parents going to certify before the child comes to school?
We've asked parents to certify. We believe that, I think in these times, we believe that parents are more aware of being cautious about health, taking temperatures, watching their children. We think they know them best. One of the things the Department of Transportation has told us is they don't want you stopping traffic and backing everybody up, trying to take temperatures on the buses. Well, by the time you have them on the buses, you deliver them to school, So we will do some temperature checks at school. If parents aren't willing to self-certify, then those students, we will deal with them. We believe we're working with our software company to do an app that allow them to do that on a more regular basis and share that information with us. But I believe parents now, the awareness is higher. The argument is that they send students to school during flu seasons that maybe aren't always the most healthy, and we recognize that for daycare issues, all those kind of things, sometimes we take a risk there, but we feel like in these times that the risk will be less, and that parents recognize that they got to be safe.
Because this isn't the flu.
This is different.
This is lots different.
That's right, and they need to be aware. And we believe they are. We believe Mascouta's done a nice job of being careful, but it's out there.
So unlike most districts, you also have a school at an Air Force base.
Correct.
Any differences that happen at Scott?
No, we actually find Scott parents to be, pretty vigilant, pretty understanding about that. The challenge we get from Scott, of course, is the turnover. We have people who are moving in that are coming from all over the country. So, trying to determine how long do they quarantine maybe before that we allow them to come into school if they start after school has started. We've had a few requests to consider remote learning for a few students who are, we had one from Japan, for example, that wants to come in, and we're kind of looking at that on a case-by-case basis. If you're not going to be here, don't really have your orders until maybe October, November, we're not going to try to address your needs right now. You know, you just come when you're here, because we understand orders change, and so then they end up being with us, and then they never really are with us. So we do ask that. Now, if we know someone for sure has definite orders and they're going to be here first part of September, right after Labor Day, then we will make them switch schools. We'll work with them to do that, and we've done that in person for forever. You know.
That's a great idea.
Yeah.
That's a good innovation. What about ROTC, extracurricular, band, chorus, those type of things? We still offering those?
Well, we are kind of. Right now, our band is practicing on the football field and observing social distancing. I, in fact, went by there today. I had to be over at the high school, and band was on the football field. Smaller groups were out in the parking lot observing that. We recognize that ISB has set some standards for band, that, you know, playing their instruments, being that inside a small classroom is not going to be acceptable. So for those kind of issues, we'll look at some music appreciation, something along that line, that we can address the music issues. Chorus the same way. There are some certain guidelines. They'll have to wear masks and do some of that stuff. Be in smaller groups. He'll do some music appreciation. So we're handling that way there at this time.
Did the state give some guidance on sports today?
The state made some rulings on sports. I'll be honest that I haven't had the opportunity to look at that. The governor did. Let's rephrase that. The governor made some recommendations or some guidelines, and it sounded like he tiered some of the sports based on their, I guess, what I want to say, how critical it might be that they might spread it, I guess. So like golf, tennis seems to be okay. Football on the other end of that spectrum, and doesn't appear that that's going to happen at least for a while. So we're looking for more guidance on that before we decide. Right now, we've continued to follow the IHSA's guidelines and done small workouts and have been able to do it just like we are with band. We're following some of those guidelines.
Great. Herb?
Doctor, thanks for coming in. We appreciate it. We got some questions that are coming in here. One I had was for the in-school learning, the disinfecting of the rooms. How is that set up?
Well, right now we have some special things going on with our custodians. They're doing some of that. In between classes, that's probably not possible. So we're asking that the students be able to help, because we're talking about high school students that would have to probably still change classes, and so asking them to be a part of the cleanup. And I don't think that's an unreasonable thing at that level. At the middle school, we're looking at a model that we would hopefully not have to have them switch classes very often, if at all. And so we can handle that. Elementary, they'd be in their home rooms for the most part, and then we think we can disinfect. And then we have cleaning coming in. We have I don't know what you call it, a fogger almost looking thing that we're using in classrooms to do that.
Brian, you had a couple other ones there?
Yeah, there's several on the band and chorus, which you've kind of walked through that process, but some that we haven't talked about yet. One question is, do you guys have plans in place if a student is diagnosed as COVID positive, as far as how will that be handled with notifications and procedures in a classroom?
We've been meeting with our nurses. They've been talking to the St. Clair County Health Department, and we're going to follow those guidelines. As I understand them today, that we would report that to the guidelines. We would help them do some tracing back who was that, and that they would be the ones, or would direct us to let parents know what happened. So that would be our plan right now.
The second question that came in relates around if students are being let out with a shortened day, as you mentioned, is there any type of latchkey or extended care for those whose parents might be working and not able to go home at that shortened time?
We have before school and after school care, as we always have. We've extended that to be at the end of the day till the regular school time, and then the regular program that we had at the elementaries kicks in at that point. At the middle school, we're offering after school care from the dismissal time until the normal dismissal time. So like we're getting out at 12:45, somewhere in that neighborhood, and we would typically be out around 3:15, 3:20. So we will try to take care of those students between that 12:45 and 3:20, and then we dismiss them at the regular time. Elementary, we've provided before school care. We're going to extend that from 6:45 till school starts, which is 8:20 at the elementary level. And then we're going to provide after school care from 2 o'clock till 6 o'clock.
Thank you.
Thank you, Doctor, very much. Sounds like you guys are on it, and
Well-
you don't have much time left, so.
Well, I know if we're going
And things can change.
that's what I think I really would like to stress with people right now. No plan is set in stone. We are looking at what our options are, what would be the best way to address safety concerns and still meet the needs of our students academically.
And Doctor, that was one of the questions that just came in. The lady wanted to know for the in-school learning, disaster plans, tornado, the students gathering in the hallways. Is that something you're looking at in your emergency plans?
That's a really good question. And
That's a
one
good
we
question,
need-
and we appreciate Team St.
Yeah.
Clair for sending that.
That's right. We need to think that one through a little bit. What are we going to do with those numbers in there? Like I say, we think we'll be at about 30%, but in our buildings, 70% attendance, for example, to high school is still over 800 students. At the middle school, it's 600.
Right.
I'd say at two of our elementaries, they're both almost 800 students on a regular basis. So if they're down a little, they're still big.
Well, I think and we've said this all along, none of your staff could predict this. Nobody could, you couldn't, and you had a short amount of time to come up with a plan. And as you said, there's nothing set in stone. This thing is changing daily, so I think the good thing is you've got a plan and it's flexible. And I think
We had 3 committees that met. They developed an in-person, a remote, and a hybrid type model. And we are getting back together as an administrative staff to review those again tomorrow and decide kind of where we're at this point. And are we going to try to modify anything? We think we're still a go with where we're at, and knowing that even if we go now, that could change in 2-3 weeks. You could start school and
and that's one thing that we're going to talk about is if the numbers continue to rise and we see ourselves going backwards, how does that affect your plan?
Well, I think clearly at that point, then you
Exactly.
look at an all-remote plan.
Sure.
And, what we'd like to do, even with an all-remote plan, is hope that we can bring in at least small groups of students, because we know that there are certain students who need to be in person with somebody. And so if we can do that, then hopefully we can continue to do remote with the others, but give some options, we hope.
Very good. Appreciate that. Thank you for coming in today.
Thank you.
Thank you
for having
very
me.
much.
Appreciate it.
So, Chairman, we sent out the sports guidelines to all the communities today, and I know we haven't even had time to go through like the doctor said, but we will brush up on that as all the communities will be doing that. We gave out another 12 agencies of PPEs this afternoon, trying to meet their needs. Our positivity rate as of July 26th is 7.6 now. As you know, we got to go down, and I'm ready to pull my hair out.
Well, we're pulling our hair out. The testing that we've been advocating, now we're having real trouble getting these tests back in the hands of people who have been tested. So that system that the state has put together for us is really not adequate. We're having people that got tested almost 2 weeks ago that still haven't received a test. Well, their results, that doesn't do us any good. It doesn't do the public any good if there are people who are out there that don't know the results of their test and they're out in public.
Yeah.
They may need to be quarantined and they may not know it. So we're working to try to get the point across that we need better test results, and we need them much faster.
Well, and I fielded a call today for a gentleman making that comment, blaming St. Clair County. And as I told him, this isn't St. Clair County testing. We're the messenger here.
The state set up a lab at Anderson Hospital in Madison County. They sent the testing equipment to Anderson Hospital in St. Clair County, and that's where the tests have been sent, and that's where the lag exists.
Well, and as I told him, we've been hearing that the labs are backlogged because of the amount of testing that we're doing. So we got to find a way to either increase that capacity or slow down on testing, and we definitely don't want to do that. So there's got to be, I hope you can pull a rabbit out of the hat somewhere.
Well, we're going to be full speed ahead on testing. We're relying on those who have taken on the job of
Testing,
being the
yeah.
ones who analyze those tests. We're counting on them to get our tests analyzed. Today we had 681 tests that were analyzed since yesterday. We are putting big numbers out there, but that's what we need to do if we're going to slow the spread. We're being tasked, we're being told to step up. That's what we're doing. The way we're able to step up is to test people, to find out where the positives are, to make sure they're quarantining, to get those people segregated and away from the general population so the general spread of COVID slows. It's pretty clear. We had 2 cases in the congregate living facilities today. That spread because the St. Clair County, Sam, the health department, Barb Holt, everybody's been out there testing the congregate living facilities, making sure that their numbers are righteous, that they know the people that are in there and they're safe. That's why you're seeing only additional 2 cases. But now the spread that we've got is in the general population, and the way we slow that is through increased testing, and that's why we advocated. Department of Health came, Dr. Ezike. They're testing in St. Clair County multiple days this week. Today they're in Mascoutah. Tomorrow in New Athens, they'll be in New Athens. These things just don't happen by chance. It's the health department, and it's the people over here that are leading this charge to try to slow the spread.
Well, and we had the staff members from IEMA in today talking with us. Dr. Ezike, like you said, had a conference call with the health department, Director Barb Holt. Everybody on our team St. Clair, the people who are following our briefings are saying, we've got to do something. And that's not easy to do. We sent out an email to the mayors telling them that they're going to be getting a call. Everybody's wanting to shut things down, but we got to find out how to do that.
And it's multiple levels. So
Yes.
Our jail, right?
Yep.
We house people at the jail. The state of Illinois isn't accepting prisoners, from us when they're sentenced.
At
And
DOC, yeah.
they're really required to do that, but yet they're saying no. So now our jail is sitting there over capacity. We're paying for prisoners that really are supposed to be the charge of the state now, but they've said, well, we're holding off. Now that they did supposedly loosen up overnight, and they're going to start to take prisoners, but we'll wait and see whether that's real. The Sheriff's Association actually sued the state and said, "Come on, it's time to pick up your game and to do what you're supposed to do. Take these prisoners out of our local jails so that we don't have capacity problems at our local jails."
So the message that I want to relay to our followers every day, because we've got some loyal Team St. Clair members, and there are people out there that are just as anxious as we are to get this over with, but it's not going to happen. We've said that from day one. We're doing everything on the county level. You're every day. I mean, I'm not seeing anybody worried about this more than you, because you don't have all the answers.
Us, the team.
It's a team, but everybody's looking at St. Clair County saying you got to do this, you got to shut this down, you got to do that. We're waiting for the guidance from the powers to be in the state, IDPH. They can tell me all day long that we can do this, but I want to know how can we do it legally. And so I think we're going to continue to work on that. We ask you to continue to be patient, stay vigilant, wear your mask, wash your hands, watch your social distancing, because I don't care what you believe. I've heard it from doctors and medical experts that that's our best defense, and we're going to continue to do it. You have your mask there. We have our mask. We hear that on there all the time. Why aren't you got? Well, if I'm sitting here with a mask on, you're not going to hear what I got to say. Then you're going to complain about that. So trust me, we are following the 3 W's. We are trying to bring you the most up-to-date information that we can. We'll have another special guest in tomorrow, which will be Jeff Daughtery from the Belleville Area Special Education Co-op. We're trying to get as many of our school districts in to provide that information out there to the parents, because everybody's wanting to know. We'll be back in just a little bit with Daisy to translate this into our Spanish-speaking communities, and then we'll be back here tomorrow afternoon at 3:30 with another update. Hopefully, I predicted yesterday, over the next couple of days, I'm hoping to see the numbers go down. Hope I'm not wrong. We'll see. We'll see you tomorrow afternoon. Thank you.